John Stossel, Art Kellermann suggested that there's a conflict between keeping people healthy and making money keeping people healthy. What about that?
There are conflicts always in making a profit and delivering service to your customers. And you get rich if you service your customers well. The hospital that keeps people healthiest gets a reputation for doing a good job. And that's how capitalism works. You get rich by doing well.
But I heard you also argue that you feel that there would be much less innovation in the U.S. system if there were not the profit motive behind development.
Totally. We take the benefits of the profit motive for granted all the time. The fact that I can go to a foreign country, stick a piece of plastic in the wall, and cash will come out. And I can give that card to a total stranger who doesn't even speak English, and he'll rent me a car for the week. And when I get home, Visa or MasterCard will have the accounting correct to the penny. But the government can't even count the votes accurately. And yet our instinct is to go to government.
Art Kellermann?
We had a lot of talking about cars earlier, and I think everybody's familiar with the economic problems that GM is having right now. And actually, I think GM's cars are better than Travant's. But they're carrying about $5 billion a year in healthcare costs. Several years ago, the CEO of GM testified before Congress and said $2 billion out of their bottom line every year was just for drugs. Now, meanwhile, Pfizer, the second largest pharmaceutical company in the United States, last year reported $19 billion in profit, 37% profit margin. I'm a big believer in market economics too, but I don't want our auto industry to end up in Ontario. I'd like to keep a lot of it in Michigan. So I don't understand. I mean, I do think profit is good, but I think when one industry can basically drive another one into the ground and harm our country, regulation is out of whack. And let me just one other point. The FDA cannot take the cost of a drug into consideration when it approves a new drug. It just has to be better than nothing. That's not by accident. Congress prohibits the FDA from considering cost effectiveness in new drugs. That's not the case in the UK. It's not the case in other countries. It should not be the case here.
Paul Krugman, I'll come to you in just a moment. Michael Cannon against the proposition.
You raised earlier, Art, is that the industry has way too much influence when the government gets involved. And it's nice to think that we could have this wonderful universal coverage plan and we could just get the industry out of it. We could just not have the industry be a part of it. We could cut off their influence. But we know that the industry is always going to be around. We know that there will always be drug companies and greedy private health insurance companies and Republicans who will mess things up like they messed up FEMA and they mess up everything else. So you can't say that universal coverage is this wonderful idea and we can separate out this part. This is an inherent part. Unless you've got all the rent seeking from the industry and all the buffoonery from the Republicans, unless you have a plan to abolish Republicans, they're part of your plan.
Paul Krugman.
Maybe we
could
put them in camps. Death camps.
Paul Krugman for the motion, please.
Camps?
That came wonderfully into exactly what I was going to say. We have had Katrina used as an example, and I thought to myself, as I always do, it must be wonderful to be a conservative because you can take control of the government, make a mess of things, and say, see, that proves my point. Isn't that wonderful? And I would also add, since John Stossel has used vote counting, you know, it's not that the government, this particular government, isn't able to count the votes. It was sort of that they didn't want to.
Michael Cannon.
But what's your plan to deal with Republicans? Do you want to abolish them, or are they part of your plan?
Medicare has its problems, but has continued to function. If we have a well-established system, it continues. Social Security is a system that's working with high efficiency. The point is to get this thing, it is. If you pay any attention, it works fine.
If you pay any attention to Medicare, you have to know that 1/3 of the money spent is wasted, that it rewards doctors for medical errors.
And private insurance? That's the thing. Actually, can I just do, I wanted to ask a question.
Please go ahead.
I wanted to ask actually two questions to the audience. First, how many Canadians in the room, please raise your hands?
We have about 7 hands
not
going
as many
up.
as I thought. Okay, of those of you who are not on the panel who are Canadians, how many of you think you have a terrible healthcare system?
We see almost all of the same hands going up.
Bad move on my part. I've got a selected, all right, I won't try it. But I will say that.
We should check their papers.
Well, we've got, that's.
Sally
gotta be
Pipes,
honest.
let's bring Sally Pipes into the conversation. She is against the motion.
I just wanted to talk a little bit about Medicare. Remember when in 1965 when Medicare and Medicaid came in and the cost was about $3 billion and it was projected to cost $12 billion in 1990. Well, in fact, it cost $107 billion. Last year, it cost $427 billion. It's estimated in 2017 to cost $884 billion. The Medicare trustees say the program will be broke in 2019. There is no cost control in Medicare. It's completely out of control. I think we need to give vouchers to people on Medicare and put consumers and seniors back in charge of their health care. But the issue is everyone loving Medicare? The recent Congressional Commission said that 1 in 3 Medicare patients is having a very hard time getting a doctor. And I have talked to many seniors who are having a hard time getting a doctor under Medicare because the reimbursement rates by the government for the 8,000 procedures on the list are too low, and docs say, I'm not going to do it.
Sally Pipes and Michael Rachlis, you're both born, raised, trained in Canada, but hearing you, Michael, argue for the proposition, and Sally Pipes hearing you argue against it, are you from the same country?
No, it's hard to tell.
No, but seriously, what about the Canada that Sally described?
I think that we've heard the other side say you can't trust research, so I guess that we just have to go on gut feeling and spin. Is that right? So I think that Sally has mentioned disparaging the international research. In fact, one of the people in the audience is one of the key people doing international research. Maybe she can speak for herself as to whether or not it is useless. But I feel that the international research is valuable, and it shows that by and large other countries are delivering the same level of care. The unfortunate thing that happened to your mother, Sally, I'm very sorry for that. That could easily happen in the United States. It could happen in any other country. A family doctor who doesn't, for a variety of reasons, take a particular complaint seriously. That stuff happens. The rate of medical error in all developed countries is about the same, although the studies have been done slightly differently. 8 countries have done studies. In all countries, 5 to 10% of all deaths are preventable deaths that occur in hospital. So that modern healthcare has some very serious problems, and this country, in fact, is a leader in looking at quality in healthcare. Dr. Donald Berwick, the founder of the Institute for Healthcare Improvement, is the preeminent person in the world on this issue.
Sally, what about that, though?
But Canada doesn't have problems with coverage, and neither does Germany or France, and we don't have problems with affordability. We have second-order problems because we haven't dealt with the quality issues.
Michael, let me give Sally a chance to respond.
Well, I mean, if you look at the Canadian healthcare system, it's not free, as Michael Moore said. Canadians pay dearly for the system through their taxes. What tax increases would we have to have here in America to provide another $120 billion
I think you
for
could
universal coverage?
You could cut taxes.
Well, I don't.
The Congressional Budget Office said in 1994 that adopting a single-payer system would save so much money on extra administration, and then you could cover everybody.
You ration care in Canada, and people wait. And my mother is not a single example. There are thousands of examples through in the mainstream media, from the Toronto Star to the Globe and Mail. It's all there. A woman stood up on Parliament Hill when Paul Martin was Prime Minister, and she stood there with her Canada Health card, and she said, "What good is this Canada Health card when I don't have access to the health care system?"